Hi everyone, thank you so much for joining us today on this evening if you're on the East Coast, and a little bit late afternoon if you're on the West Coast. Today we're going to be talking about Child Care and Development Fund and the notice of the proposed rulemaking. And with us we have the pleasure to have Shannon Rudisill, the Director of the Office of Child Care at the Department of Health and Human Services, who will go over what are some of the rules, and at the end of the presentation we'll have time to answer your questions. So with that, I will turn it over to Shannon.
Hi everyone. I cannot thank you enough for joining us this evening to hear a little bit about an exciting policy development that we have at the Department of Health and Human Services around child care. And I know some of you were planning on doing this with us last week, but because here on the East Coast we were expecting just horrific weather, we thought that we were all going to be out of power and out of internet on a broad swath of the East Coast, and thankfully that didn't come to pass. So we appreciate you being able to reschedule with us. And I know that this is maybe just after dinner time, bath time. I have 2 kids of my own who are home with my husband doing that, and I got to say thank you especially to the parents who are dialing in from their home offices, because I don't honestly think I could do this very successfully if I was in my house right now with my kids knocking on the door. So Leslie, your lines are all muted, so we will not know if there are kids knocking on the door or you know, screaming, "Daddy, Mommy, you know, I need a drink of water," or whatever. It's really, I've been looking forward so much to this webinar. We have been doing a lot of outreach around these new proposed regulations, but it is truly the parents and that we've heard from around the country that have inspired us to work on this. My policy rating team at the Office of Child Care, which is only a few people, about 5 people, have been working on this for over 2 years, and there were times when it was just a very challenging thing to work on, and we had parent stories from around the country that really provided motivation to keep us working. When we published this proposal just around May 17th or so, we were actually joined by a parent advocate from Virginia, Ellie Lafkin. She stood with our Secretary of Health and Human Services, Kathleen Sebelius, and my boss, our Deputy Assistant Secretary, Linda Smith, who used to be the director of this organization, Child Care of America, and myself. Ellie was there, you know, right with us, as well as a family child care provider and a big center director. So parents have been with us all the way, and it's my privilege to talk with you about it tonight. I will say that this can get a little jargony, and so I'm going to try, and my slides are slightly jargony. They have a lot of bureaucratese. I'm going to try to put it in as plain language as possible, but there are no silly questions. I am a big believer in all kinds of questions. So if we say something that does not entirely make sense, it is not you. It is the fact that we're probably communicating in some sort of federal language, and you should just ask a question at the end about that. So first we're going to find out a little bit about the audience so I can tailor the remarks to whether we have more parents, more providers. So a poll is going to go up, and if you are able to look at your screen, please let us know a little bit about who you are. Okay, this is very exciting. I don't know if you all have ever been on the other end of one of these, but you can watch it take place here. All right, I'm going to look at my colleagues. Do we show the results? Okay, the results are forthcoming. There they are. Okay, you can see the results. So it looks like we have a lot of providers on the phone tonight, which is fantastic. And you know what I'll do then is I will, and I imagine it's some family child care providers, so everything that I said about the end of a hard day, and you know, you can definitely relate to that. So I will try to be sure that there's a provider focus as we go through, but do not hesitate to ask any questions that you have. Okay, so first, just a little bit of background, because I think background is going to be really important. The Child Care and Development Fund, that is the federal program that this regulation would apply to. And the reason I'm bringing that up is because it is a program in which the states have a lot of flexibility, and that means that the states frequently rename it to something in their own state. So depending on what your state you're in, this program could be called Child Care Assistance Program, it could be called CCAP, it could be called something works, a lot of different names. So, but in the federal government, we call it the Child Care and Development Block Grant or the Child Care and Development Fund. There are currently $5 billion, approximately, it's about $5.2 billion actually, appropriated each year, federal dollars, for the Child Care and Development Fund. States put a match to that, and it actually ends up, in terms of spending through the program, to be closer to $10 billion, because this is the federal part, but the states have to match it to pull it down, and so it goes up to almost $10 billion. So this is a very significant amount of money that we spend on child care every year. And it's important to note that it's for states and territories and tribes to provide the services. So money doesn't flow directly from my office in the federal government to a child care provider or to a parent. The money comes from the federal government to the state, the territory, or tribe. And we have a lot of tribes, almost over 500 tribes participate actually through tribal consortia. So that money goes to states, territories, and tribes, and they run basically two kinds of programs. They all run a child care assistance program or a child care subsidy program that helps low-income families pay for their care. And they also spend money on quality, usually for all providers. So by quality, I mean provider training, grants to improve quality, quality rating and improvement systems, which, because we have so many providers on, I'm guessing some of you know that term, star rating systems, training associated with star ratings. They may spend it on child care licensing. About $1.2 billion actually goes into those kinds of quality improvement, and I think folks don't always realize that. And that means even for the parents who are on the phone, even if you are not getting a child care subsidy, you are likely benefiting from this Child Care and Development Fund because your provider probably had free or low-cost training that at some point, if you could trace that dollar back, came from this fund. If there's a particular curriculum being implemented in your place, you know, that might have been purchased with a grant from this fund. So it really impacts a lot of folks. I always say that although I've not received direct subsidy assistance, my kids, who are currently 7 and 10, so they're school agers now, we have benefited from this because I know for a fact that my providers went to training here in Fairfax County, Virginia, that the money originated with this fund. And then it went to the state of Virginia, and then it came to Fairfax County, and then my provider went to training. The other thing to note when we're talking about ages is currently this is enough money to provide child care subsidies to 1.6 million children every month, and we serve kids up to age 13. And if you have a school-age child, you know, like I do, that child care needs don't stop when they go to school. Summer is coming up, and whoa, man, right? Getting summer child care is quite a juggling act. So our money is for kids 0 to 13. A couple other things I'll mention. We are really proud of our program because we feel like it has impact on 2 generations at the same time. It has impact on parents who are able to go to work and support their families. And of course, it has the goal of fostering healthy child development and school readiness. And as I get into the rules that we're going to talk about tonight, a lot of our rule focuses on that second part because the program was really born in 1996 at welfare reform times, and the statute and the rules are already pretty solid on the parents' working goals. But we know a lot more about child development and brain development than we did, 20 years ago, and so a lot of our improvements are around the child development and being sure kids are safe and healthy and ready to learn. Okay, so I'm going to move on to the next slide, just talk a little bit more about how this rule fits in. So I won't spend too long on this, but I will say a couple of things. This rule is part of President Obama's plan for early education for all Americans. And if you've been watching the news, you know that the President has come out with a very exciting plan for preschool for all 4-year-olds and working for infants and toddlers through early Head Start and child care partnerships so that we could serve about 100,000 more infants and toddlers in really great quality care. This rule, we see it as sort of a companion piece because, as I mentioned, we're spending billions of dollars already on child care, and as you know, we'll talk about, we don't always have our health and safety and quality bases covered in our existing program. So, you know, as I'm part of the President's early learning team, we're thinking of two things. We're thinking of continuing to strengthen the programs that we have already, like this one, the Child Care Development Fund and Head Start, and expanding with some exciting new programs like Preschool for All and more early Head Start child care partnerships. So it fits into the President's bigger early learning agenda, which is historic. And you're probably hearing about from Child Care Aware of America about that as well. I also mentioned a little bit about how it builds on what we know from brain development and that early childhood programs are really key to kids' learning. And the truth is, most American kids still get their school readiness in a child care setting. I mean, there's more child care available than there is pre-K or Head Start, and that's why it's critically important that we think about not only the parents need to go to work, but also the kids' school readiness. And I know that's what I want for my kids, and that's what parents want for their kids. And finally, before I move on, I just want to note that, you know, I talked about how we developed this over a period of years. It came out of conversations we were having all around the country. We talked to the states and territories and tribes about what works and what doesn't work in this program that we provide the funding for. We talked with many, many providers, when provider groups are here in town, Family Child Care Association, other national child care associations, National Association for the Education of Young Children. We talk about their providers' experiences in being able to provide high-quality care and get paid for it. And we talk to parents, and Child Care Aware of America really stands out in terms of helping parents come here and talk to us. It's always critical. If you're a parent, I urge you to reach out and let us know about your experiences. And if you're a provider, there's nothing more rewarding and interesting to us than talking to you all, because it's the best way we know what's happening with our program on the ground, because we sit in an office building in Washington. Everything I'm going to talk about tonight is on the web, and these are going to be handy links for you. The most important thing is, I hope, that when you hear this, you'll want to comment. This is out for public comment. That's why we're talking to you, because we're doing outreach around trying to help people be better able and prepared to publicly comment. And it might seem intimidating to comment on a federal regulation. I'm going to be honest, I don't know that before I came into government, I can't do it now, but on this one, but before I came into government, I don't think I did it. Let me tell you, you need not be intimidated. So if you go on to regulations.gov, which is here, and you could search Child Care and Development Fund or just child care and you know, watch the search results, it works just like commenting on a newspaper article or something. You could just type in your comments, and they're available there. If you know you need to, the attorneys want to be sure you're not commenting on the PowerPoint, right? I just picked out the highlights here. These are just the things I thought would be most interesting to you. You need to at least attempt to read the rule and then comment on the actual rule itself. But we're trying to make it easy, right? We try to put everything online, easy to access. So we'll talk about this again at the end. But you know that you have till August 5th. I know it's summer, but you got plenty of time till August 5th to try to delve into this a little more and to go on regulations.gov and give us your feedback. I tell you, we really want it. My team is laughing at me because when you post a comment, it first goes to a member of my team because she needs to read it before she puts it up online to be sure that we're not getting spam or that like nobody uses profanity. And so it goes through her, And that's all she's checking for. She takes out people's personal phone numbers and stuff too. She redacts those. And then she posts it. She doesn't change the content. But I sit at my desk and refresh the website like 5 times a day because I really want to know about people's comments. So I just want you to know, you may feel like sometimes when you're interacting with the government, where is this thing going? We are reading this. We want it. We want to hear from you. Okay. What happens after you comment and after August 5th? We will read your comments, and we will, and all the comments that have come in, we're up to 46 as of the time I left my office today. That's a good amount of comment, but I got to tell you, the last time my sister partner agency, the Office of Head Start, posted a rule, they got 16,000 comments. So not that we're competitive, but we want comment. And so what would happen then, though, is there's a lot of phase-in time that states are going to have to make some changes here, and then providers might have to make some changes, and we're about to get into the meat of it. But we would basically, there's a lot of jargon on this slide talking about the phase-in, but what you probably need to know is, and I'd like all of you to know it, especially our providers and our parents, your states, all of them, plus the tribes and the territories, send the federal government a plan every 2 years about how they're going to use this $5 billion. In fact, they're sending one to us on July 1st of this year. These rules are just proposed. So basically, 2 years from now, the next time they send in their plans in 2015, we would expect that they would have made the changes that are in the regulation. I hope that makes sense. So the things to know there are every 2 years, your state or tribe sends us a plan about how they're going to use all these millions and millions of dollars, and the next time they do that will be 2 years from now, and then we hope that this will be a final, and they'll be able to show us how they're in compliance. These are all public. The states have to, and tribes and territories have to do public hearings about it, and I really hope that you go on your state website, you read it, you participate in public hearings. The one they're about to send us is under current rules, so what I'm talking about tonight won't go into effect until the next one 2 years from now. Okay, now the meat of the matter. We have 4 priority areas, and I am not going to talk about all of them tonight because we tried to scope it down to things we thought would be most relevant to you. But the rules, proposed rules, are in 4 priority areas. Health and safety, that's a big one we're going to talk about. Family-friendly policies in the child care subsidy system itself. And then a few provisions we're going to talk about around improving quality. I'm not going to focus too much on the program integrity. That's the state's financial, the financial aspect of what they do, and we've talked to the states about that. We've had many webinars from them. In the interest of time, we're not going to do that one tonight. Okay, so we're going to take one more quick poll before I launch into this, because what we want to know is, for either the parents or the providers on the phone, do you participate with the subsidy program now, either by taking subsidy kids or as a parent who might receive a child care subsidy? Okay, the voting is going on. We'll give it about 5 more seconds. Okay, I think everybody who was going to vote probably voted. Oh, maybe not. Okay, so it looks like over half the people who are on participate in subsidies. So there'll be certain provisions of this that will affect you more directly, but there are certain provisions that will benefit every parent and provider. So I'm going to try, since we know this, to be a little bit clear about that. So the first thing we're going to talk about is health and safety. Okay. So that rules make changes in terms of health and safety in an important way. It's really important to keep in mind that the federal government does not regulate child care providers. We don't we don't directly regulate any child care provider, except, military ones DOD regulates. But, by and large, the federal government doesn't regulate child care providers. States and tribes and territories regulate child care providers. So what our rule does is say, we've noticed, I'm going to be honest, states are supposed to have some health and safety requirements in place for providers that are accepting child care and development fund subsidies because it's, we have an interest in seeing those kids are healthy and safe. Most providers do a fantastic job and go way above and beyond just keeping kids healthy and safe. But what we've learned over time is in some states, big safety gaps persist, and there are holes in the system where we have a lot of providers who are participating in CCDF and don't necessarily have all the core things in place we would want, especially, we have a lot of unlicensed providers participating in CCDF. We have at least 10% of the providers who are unlicensed and aren't family members, are small businesses that are unlicensed and are taking our subsidy kids. And so in those cases, we need to be sure there are safeguards in place. So we're basically going to require that states put in place a minimum floor of health and safety for providers who receive CCDF. Now, this will really only apply to providers that are participating in CCDF, but we think this is going to have a huge impact on child safety because we have 500,000 providers participating in CCDF, and some of them aren't licensed any other way other than getting CCDF. So we got 500,000 providers, and we think that we could potentially positively impact the safety of millions of children because in a child care provider, like just take my own child care providers over the years, my kids don't receive a CCDF subsidy, but some of the other kids in the class do. I mean, typically I don't know which ones because of confidentiality, but I know that some of them do. And that means that if the provider had to get extra CPR training or some other kind of safety provision, my kids completely benefit from that. They're with a provider that's well-trained, that's meeting standards. So it benefits not just the kids who are on public subsidy, but all the kids. All right, so let's talk a little about what these new health and safety requirements are. The first one has to do with the building, the physical building and the children's physical safety in that building. So to put this into the most plain terms possible, the states would be required to put in place standards that if you're taking CCDF children, you need to comply with state and local applicable fire, health, and building codes. We're not making new ones at the federal level. We're not saying they have to write new ones, but the existing ones. And if you're in a family chapter home, they might be different for homes than, buildings, institutional buildings, and it would be the ones that apply to you. We're also saying that if you're going to care for a kid with CCDF, you need to have a criminal background check. Most parents, and Child Care Aware has the polling to show this, assume all of this is happening. And, we just have too many places where it's not. And to have some emergency preparedness planning around evacuation, reunification, emergency contacts. You probably already have this, right? You probably have your go bag ready. You probably have shelter-in-place water. It's hurricane season. We've had these tornadoes. But we're just kind of shoring up the minimums here, be sure everybody has it. The states do fund some relatives to care for kids with CCDF, and they could exempt relatives from this. They, grandma, aunts, etc. Okay. The second area of health and safety that we're really shoring up is to be sure that child care providers meet a minimum set of training. So I would recommend that you just look at the slide because a lot of things in this PowerPoint are highlights, but this is the full list of training is on the slide. So again, this is not an, I guess our Deputy Assistant Secretary always says, this is not about trying to create a Cadillac program, although we want that. We want a great program for our kids, but what we're doing here is we're putting a floor of basic health and safety. And we know some of these things just aren't happening. We've, in a few states, which I guess I won't, in Minnesota, I guess I will name, in Missouri, we've had a lot of kids dying of SIDS in childcare, and, we've had varied results with getting safe sleep training in all the childcare providers. Missouri hasn't instituted that yet. So we're saying there needs to be at least a basic floor. If you're caring for an infant, you need to understand safe sleep. If you're transporting children, you need to be able to do that safely. Where I sit, I get lots of news clips across my desk. I subscribe to news clip services, and I dread the summertime because I know we will have children harmed being left in hot cars and vans in child care settings. And we just want to ensure everybody is properly trained to understand how quickly, their harm can happen. So those are just some examples of the reasons why we're doing this. Okay, so this is our list of safety trainings. I'm going to move on now. Okay, the last part of health and safety has to do with monitoring. One thing we've noticed is that if you're licensed, you're probably getting monitored in a lot of states. But again, we have a lot of unlicensed caregivers in CCDF, and that's fine if the state wants to do that. We're just saying that if you're doing it to the states, if they're doing that, they need to ensure some other kind of monitoring is taking place. Specifically, there need to be unannounced on-site monitoring visits to the providers receiving CCDF. You don't have to go to relative care providers, but to other non-related providers. Parents, again, child care where it has the polling data, parents assume this is happening. They know the restaurants are inspected, right? They assume this is happening, and it's just not always happening. The other thing that we're, and some of you may have this, I don't know, we're changing something about self-certification. In some states, for some part of the providers, the only way we know if they're meeting health and safety is the state mails out a checklist. The provider fills it out. I have a fire extinguisher. I've had CPR. I don't have a pool in my backyard that's uncovered and open. And they sign it and they mail it back, and nobody ever goes to check. And I've talked to a lot of really great providers, including the family child care provider and the center provider that were with us when we announced the rule. And, they would never do this. I mean, they want to be sure they're participating in a system of quality, right, with inspections. And they want to be sure that taxpayer dollars are going to providers who are ready to meet that higher standard of accountability. So that's what we're trying to do here. States vary right now on how they're doing this. So if your state already does this, they won't have to make any changes at all. But we have certain states where this isn't happening, and they would have to make the change. That's true for all of this, by the way. If your state's already doing it, no change needed. We're just trying to be sure that everybody gets to a basic level of practice here. Okay, just a couple more things about health and safety. If there is a complaint to the state about a risky situation, then the state needs to go out and do a visit then, and they need to set up a hotline to take those complaints. Because parents are in programs more frequently than inspectors ever are. And, we just want to be sure that if a parent sees something, they know who to call. When I was looking for child care around here, my husband and I, this was several years ago, went to visit a provider that came highly recommended by a neighbor. The front door was propped open, and this is in a very populated area. We walked in, and we stood in the lobby for 10 minutes, and nobody knew we were there at all, which means not only could anybody have walked in off the street, but, a child could walk through a prop door. It's pretty easy to lose sight of a kid and have them wander out the door. And then, we went to see the toddler room, and the building was built in the 50s and 60s. Paint was peeling in the bathroom by the little toilet. So right at child's level, we've got layers and layers of peeling paint. That was my neighborhood. I know about that paint. That is lead paint because that is an old neighborhood. Like, all of our houses had to have lead paint sealed up. So I knew to call the licensing agency, and I did. But not every parent would know that, right? So the idea here is there would be a hotline that parents could call so that the state could just go out and check. We're not looking to have a lot of unsubstantiated things that you act on. That's not the point. The point is that that it would be validated by a visit by a professional, right? Because we know sometimes providers worry about substantiated versus unsubstantiated complaints. So the state would go out and look, right? And just it triggers a visit. We're also going to require that providers serving CCDF kids report serious injuries or deaths of kids in care to the state. We were shocked when we looked at just the licensing rules in states Only 33 states require licensed child care centers to report deaths of children in their care to states, and only 25 states require licensed family child care to report deaths, so that's only half the states. And one thing that we've learned from talking to our states when, tragic things happen, sometimes we want to prevent, and most of this rule is aimed solidly at prevention. But if something happens, we want to be able to analyze in detail what happened to figure out if there was something that could have prevented it. So if you see that there's a rash of SIDS deaths, then that's helpful because you know what kind of provisions you need to put in place, right? In Tennessee, which is an outstanding leader on transportation safety, it's unfortunately because in one summer, a few children had tragically died in vans, but now they're the nation's leader in terms of transportation safety in child care. So that's what we want this reporting in order to improve and to learn. Okay, the final thing on health and safety is this is just illustrative. You can comment on any of the things I just talked about or anything else in the rule. But there are certain places, if you go read it, where we talk about, okay, this was a matter of internal debate, or we know there's a lot of discussion in the field, and we wanted to point people to certain things that we really, really want comment on. And so I've put a few of those here. One of them is phase-in. So I know we have a lot of providers on the phone. We think 2 years is a good phase-in, a generous phase-in, especially since a lot of states are doing it already. But we know people are going to want to comment on phase-in, right? I know I have providers on the phone that might be interested in this. We've only talked about background checks for the providers, but it's pretty common practice to check the other personnel in the center too, or other people who live in the family child care home. And we haven't done anything on that. We've asked for comment on that. So when you look at it, I hope that you'll think, and I won't go over all of these points, but you could comment on anything, but there are certain things that we've sort of said we'd like more comment. Okay, we're going to talk a minute about family-friendly policies in our child care subsidy system. So I mentioned 1.6 million kids every month get subsidy and 500,000 providers participate, but we know that that system is not always working as well as it could to help families stabilize their lives and to provide providers with predictable payment because families come on and off frequently. Our data shows that families come on and off subsidy on an average every 3 to 7 months. And when they churn like that on and off subsidy, I think it's bad for their employment, it's bad for their kids' development, and it's bad for a provider who's trying to provide quality to have that kind of churn, in her clientele and her payments. So we're working on that in this rule. We're saying that states should not do a full reapplication process with families any sooner than every 12 months. And right now, about half the states have complete recertification reapplications every 6 months. We're saying, no, that needs to be at least every 12 months. Some things happen that families might need to report to the agency. I mean, if their income doubles because they got married and they're a two-parent family, maybe they need to report that. And maybe the agency wants to act and say, okay, that makes you unqualified. But we really want them to minimize those situations to the ones where they really feel they need to act. By and large, we want to make low-income families' lives more manageable because it's better for them and they're staying employed and supporting their families, and it's definitely better for their kids' development. I know both the parents and the providers on the line know that relationships are the complete heart of child care quality and learning and school readiness. And if we're cycling kids in and out of care all the time and we're undermining the relationship, it's not good for the kids. So that's why we're really saying to states, whenever possible, let's let the families keep the subsidy for 12 months before you go do that whole reapplication again. And let's not put so many hoops up. The last thing I'll just say about this, a couple more things. We're going to require that states give families time to find a job if they lose it when they're on subsidy. So one of the reasons, low-wage families working service jobs, they change jobs frequently. These, not always the highest quality jobs. We're saying that the state needs to let the family keep their child care while they look for another job. Now, the state sets almost all the policies in our program, and we respect that. So we said that they could decide how long the job search period is, but they need to give some job search period. if you can comment on that. You can comment on whether we should have left it to the state, whether or not there's some minimum. We did it because we think economic conditions vary a lot around the country, so maybe it makes sense to let them set it. But you could comment, for example. A couple other things, because I know we have some providers on the phone that might be interested. We're going to make them start telling us in their plans, their every 2-year plans that they send to us, how their payment practices support quality, how they're designed to have more providers participating in the subsidy system. So how it's not a hassle that keeps providers from wanting to participate, and how payment rates support quality. You might also be interested to know that we're going to do another tweak, which seems small but might be big for some families and providers. If the state is going to cut rates or bring down cut payment rates to providers, bring the eligibility lower, or raise the family's co-payment, the family's share of payments that happens in subsidy, they need to give advance written notice to the providers and the parents that would be affected. We haven't had that before. And it came to our attention that sometimes co-payments go up for families without a lot of notice to the family to plan. Rates might be cut without providers having time to plan. We didn't say how long the notice period is because, again, states decide most of our rules, but you could comment on that. Okay, last section. So we're just going to have a couple slides about consumer education. And I will say consumer education here affects every parent and provider using child care, not just the ones with CCDF subsidies. So this is an area that we feel passionately about because we feel like parents need better information when they're looking for child care, and providers benefit when parents can find them. So the first thing in consumer education is we're going to require that states put on the web the results of their inspections and the provider's health and safety track records. 30 states do this already, and a bunch of others are kind of in a development process. So this really is just going to be about the few states that haven't done it yet. I've used Virginia's when I was looking for care. It was very helpful. And I just talked to my college friend who was looking for care for her toddler in Columbus, Ohio, and she used theirs and found it also very helpful. It's not the only thing to look at. We know that. I'm sitting in an R&R agency here. That's not the only thing that matters. It's not the only thing we look at, but it's a helpful place to start. The other thing we've noticed is sometimes information isn't really available to subsidy clients that middle-class families are using, right? Middle-class families are on the web. They look for everything on the web. Subsidy clients, don't always have access to information to make that choice. So as part of the intake at the state agency, we want them to share with the families who are getting a child care subsidy what's the track record of the provider that they've chosen. Especially if it's a provider that's not, in a licensing or other kind of system, they'd be able to say, look, this provider that you've chosen doesn't meet this amount of requirements that we have for these other providers. We want to be sure you know that, to just give them a little heads up about what is or is not met. Okay, but we all know we don't want to just stop at health and safety, right? We want to go further for our kids. And so we're also telling states that they would be required to set up a system of quality indicators. What is that? What is a system of quality indicators? Simple indicators of quality that parents can use to select care. Now, states have tons of latitude about how to do this. We just said 3 big categories. Something about teaching staff qualifications, something about the learning environment, and something about curriculum and learning activities. States get to decide. If a state already has a QRIS program, a quality rating improvement system, they're already doing this. But for families, we feel like this is kind of information they need. This might not be everything. States might want to add things about whether or not the program serves dual language learners well or other things. And remember, the health and safety we already took care of. So these are extra things. States decide whether this is mandatory for providers or voluntary for providers. And states decide they might make it mandatory, but exempt some people from participating, like faith-based providers if they want to. you know, I think this is just about parent information being available. Okay. And in this case, we're seeking public comment on a few things that I thought might be particularly interesting to you, so we left this slide in. So, as I mentioned, you can comment on anything. This is by no means trying to limit or direct your comment. But in this area, we specifically said, okay, we'd like help with these categories, right? Because on the one hand, we want to recognize that all the states are doing kind of different things in the area of consumer ed, and we don't want to necessarily make people go back and undo something that's good that they've done. So we made these broad categories. We want you to have some quality information available about teacher qualifications, learning environments, and curriculum or learning activities. We're asking, is that the right categories? And we certainly think many people will go beyond that, like I said, and have other things. But we wanted this is about the basic common denominator across the states. And also we want information, especially from our states, and R&R agencies will be great at helping us with this. How do we explain this in plain language, like I'm struggling to do on the phone? I mean, I know the first time I looked at a licensing report and it said there was a lapse in supervision, I thought that that was meaning that the director wasn't supervising the teacher well enough, which, okay, that's fine, but I don't care about that as much, really. I came later to realize that meant that the teachers weren't supervising the kids. It never occurred to me that's what it could possibly mean, because that's why we're all there, right? So we use some language that we think it's obvious what it means and it might not be. So we've asked for comment on how we can make this understandable for folks. Okay, we're about to get to questions. And what I will do is I want to leave up on the screen for a few minutes this information about providing comment. So just a reminder, the comment period is open until August 5th. You can mail the comments to this address, and that is fine, but it's really, I think, a lot more effective and easy to use regulations.gov. I know you have access to a computer because you're on this webinar. But if you send it in the mail, we will get it, but it goes to a security facility first. So there's a little delay, and it goes through a bunch of machines, and we get it sometimes a little bit damaged. But we can read it. It would really help if you would say what you like as well as what you don't like. That's just my personal plea, because I'm the one looking like 5 times a day. And I presume there's probably some things people like and some things they don't like, because it's a lot of changes. Also, if you could give us a reason, that helps immensely. Or if you could tell us that there's an implementation challenge that we haven't thought of, and as providers and parents, you might know about implementation challenges we haven't thought of. That really helps too. So you can say, I like it or I don't like it, and just be that simple. But what really helps us is, I like it because, or I don't like it because, or I wish you had done this other thing instead, because I think that would work better. We can use all of that kind of thing. Okay, so questions. Okay, so I think that one of our colleagues here from Talk Aware of America is going to read the questions. Okay, let's see. Oh, can I speak louder? Wow, we should have been looking at that earlier. I am really loud. I hope that eventually you heard it. PowerPoint available to download. Okay, so I'm speaking louder now. Sorry we weren't being as attentive to that box. PowerPoint is available on our website. So what I am going to do is I'm going to advance the slides, if it will advance while we're doing this. There we go. Okay. PowerPoints are on the website. It's on your screen now. It's this one that I just did, but it also has some additional slides that pertain to states and stuff that we cut out.
Okay, and also we have recorded tonight's webinar, and it will be posted on our website, and we can also post the slides here as well if you're looking for another place to find them. Okay, going through some of the questions here. How often would unannounced visits be required?
Great question. I'm glad you asked it. So we have said that in the rule, we say that is up to the states. But in the preamble, which is sort of our document where we explain ourselves and give our rationale, we recommend that it be before caring for children and once annually. You know, I guess what I would say about that is one of the areas we've singled out for comment. So right now that would be up to the states, but we've asked whether or not it might be a good idea for it to be before caring for kids and once annually.
Okay, great. And just a reminder, if you do have questions on tonight's webinar, you can type this into the questions box on the side of your screen. Just a few more questions coming in here, trying to sort through them all.
Okay, I think this says family-friendly is what I think that is. Okay, do you want to read it?
Okay, family-friendly policies should include provider notices for change in subsidy and provisions to pay for space regardless of hours and care. Stop penalizing part-time care when a child comes 4 to 5 days a week, but less than 20 hours, because the spot is taken by that child regardless of hours of service. Also, provider vacation or closed dates, which are not holidays, should be paid as we hold spots for those children without pay when a parent is unable to afford care. This hugely penalizes providers and prevents many providers from taking CCDF children. What plans are in place to address these 2 points?
Okay, thank you so much for bringing that up. So a couple of things that I will note. First of all, I guess I should have also need to reiterate, if you comment on this webinar, it actually doesn't count as official comment. So I hope that you will take this comment or anything else you'd like to elaborate and put it in regulations.gov and say, I'm worried about this issue. Because, you know, this is an issue that comes up. A couple of things. We totally have heard this. And, you know, we talk about paying providers sort of consistent with market practices. We don't specifically get to the number of attendance days you would pay and that kind of thing. You know, I think that you should take a look at it and comment about the way you would like to see it. However, we are also worried about this paying just when parents are working or not covering days when children are absent. And there are a couple of provisions that address it in the rule. One is states used to do a lot more contracting for slots. But now there's hardly any contracting for slots left. And this is kind of technical, but it gets to this question. Only, you know, like Massachusetts and California and New York City, Connecticut still have some contracts. Everybody else is using vouchers, which means it's less likely that you pay for the whole slot, more likely that it move around some. One thing that the rule would require states to do is do a supply analysis of their state and the supply of child care available around the state and the supply of child care like for infants and different categories of kids, and to start using some grants and contracts to provide that supply, which means a high-quality provider could get a grant or a contract to reserve slot, which I think would help with this to some degree. And we're also clarifying for states that they don't have to restrict the amount of care they authorize to the exact working hour of the parent. Now, a lot of them probably will do that because of money issues, right? We're only serving right now 16% of the kids who are eligible for a subsidy. Okay, that's a very low amount. So states have to ration, they feel like. But one thing we have in the rule, which I think will help, is clarifying that we don't consider it an improper payment, a bad payment, to pay for a full-time slot, even if the parent isn't working full-time, because that helps the parent get into higher quality care. So I've been talking to states about this a lot. So say I'm a mom, and I work Monday, Tuesday, and Wednesday from 9 to 2, and then Saturday and Sunday, and you only give me care during that time, I'm probably not going to be able to go to an accredited place because they can't make it if somebody's only paying Monday, Tuesday, and Wednesday from 9 to 2. And so we've been talking to states about, we want you to know you could authorize more, especially, and this is our big interest, if doing that would get the kid into a higher quality provider. I hope that helps.
Okay, another question in here. Other funds, such as Head Start, are set per child. Why is this not done with CCDF?
That is more of a philosophical question. You know, in the statute, it really talks about providing care in the market and parents buying care in the market. There's also reauthorization moving in Congress, and I'm sure the Child Care Aware of America is working on that as well. We're concerned that payment rates in child care are quite low and, you know, lower than we believe the cost of providing quality service. There is only a little bit that we feel like we could do in the current law with this regulation around payment rates. But the contracts I just talked about are one way that a state could say, we're going to contract for high quality slots, and this is our contract amount. And I think that it would be more like Head Start, right? Head Start is more like building up the supply, and that's what that would help do.
Okay. Why is there no travel time for parents if they work 40 hours per week and have travel? Then this amount is not included in the CCDF.
That's a great question. So I will let you know that is a state option. In fact, they certainly could authorize travel time, and many states do. In fact, we might, in my office, have a stat about how many do or don't. That I don't have it in my head right now. States could authorize travel time. States could also, they authorize study time for parents. If if people are getting CCDF because they're in school, they can authorize study time. If parents work at night, they can also authorize sleep time so the parent can sleep during the day. All those kinds of things are allowable, and one way is, this is a block grant. That is one thing that is very clear is Congress intends this as a block grant for states to make this kind of detailed decision. So that is a matter to take up with your state agency. It is allowable, and a good way to take it up is to engage with them when they're writing that plan. That stuff is usually outlined in the plan. Okay.
Okay. How can we provide more consistent care for parents who have inconsistent work hours in non-traditional child care center?
Okay. So this is something that we've also been thinking about, because I think that a lot of this, again, is something that states can work on in their policies. So, for example, if a parent has work hours that shift around a lot, some states make that parent constantly report, like, on all of those work schedule changes. And what we're trying to communicate is you don't really have to do it that way, right? You could do averages of the hours at the intake and authorize some sort of big band, right? So that the care can be consistent even if the parent's hours are fluctuating. Or that example that I just gave about you could authorize more hours so the family could be in, say, a family child care or center care during the week, but they need to be with grandma on Saturday night because we know, or sometimes on the weekends. Maybe it changes. Maybe sometimes it's Saturday, sometimes it's Sunday. You can authorize that, and a few states do. So, I mean, I know this is technical, but, like, the devil is in the details with some of these state policies, and I want you guys to know that states can do these things. And we've been working with them to say family stability and child stability is a really important thing, and that should figure in when you make these policy decisions.
Okay, so we have time for just a couple more questions here. One question that came in: do these rules encourage states to choose quality over quantity when making allowable policy decisions?
I think what the rule is trying to do is to increase the likelihood that families in CCDF especially are more likely to be served in higher quality care, and also to be sure that all families, regardless of whether they're getting a subsidy or not, have better information so that they can choose higher quality care. I mean, that's really what we're after here. And, I think that we all know that the block grant has been flat, with the exception of $2 billion that the President secured in the Recovery Act, which is mostly all gone now, spent out. It's a lot of money, but it's been flat for a long time, and states have generally tried to hold on to their caseload as much as they can, and that means that payments is really where it comes out. So, you know, I think we've about run up against the end of that strategy. And I'll just note here that one of the things we were working on in the President's initiative is big new increases, including $1.4 billion he's asked for from the Congress this year for early Head Start child care partnerships. That's separate from this rule, but the reason we went that route of early Head Start child care partnerships is because it would bring child care providers into early Head Start grants, basically, and they would need to be paid at the early Head Start rate. So I think that is a good example of a balanced approach where in new money, we are definitely talking about we only want new money to go to quality, and in the existing programs, we're trying to shore up quality without destabilizing these programs too much.
Okay, great. Well, I know that we still have a few questions coming in here, but we do want to be respectful of everybody's time tonight. So if we did not get to your question, I apologize. And I'm going to put an email address up here. If you have any further questions that we did not get to tonight, please feel free to shoot my colleague Nick an email, and we will look into the answers and get back to you. But we do want to thank everybody for joining us at our webinar tonight, especially Shannon. Thank you for joining us and hosting our webinar. But we